Okay, so for chapter 5, the title is called The Rise of Lifestyle in the 1900s and 1980s. The author discusses the history of public health from the 20th century and how it went through more redefinition. The author covers how during World War I, the primary focus of public health was on the mothers and the babies. There was a rumor that babies had a more dangerous life than a soldier. This rumor was due to the assumption that infant mortality was increasing. However, according to the author, the author states that infant mortality was actually decreasing. The author later discusses the delicacy of legislation and how during the war, at the local level, prohibition was extended out for tuberculosis and for STDs. The author explains the delicate question about whether or not providing information and harm reduction techniques like condoms encourages or prevents risky behaviors. In my opinion, it's better to educate regardless of whether or not it encourages sexual activity. If people don't know what's out there, how are they supposed to know how to be cautious to begin with? The author covers how alcohol was a big concern during the war. The board ended up putting restrictions on pub hours, which actually lasted up until 1987. Other concerns during the war included venereal disease, tuberculosis, and alcohol. Yet surprisingly, the author said that those concerns decreased in importance after the war, but the author didn't explain why. Since diseases were changing, they came up with a term called epidemiologic transition to explain it. The author addresses how eradicating how educating the public had been a priority for public health professionals. Public health professionals even included talks, articles in the press, and public meetings to receive information. Soon later, television came in, and then public health professionals used television as the main way to aim at the entire population. There were changes in health services as well, which influenced public health professionals to seek new avenues. Instead of public health's main priority for quite some time being about epidemic infections and diseases of infections, the transition began to focus on diseases of lifestyle and chronic diseases. The author describes how for both male and female, infectious diseases declined. And as chronic diseases escalated, the author covers that chronic diseases are linked to behavior rather than infections or polluted environments. This is an interesting point, and it correlates to my topic because the nutritionist's focus is to change behavior and to improve lifestyle habits and decrease in chronic diseases. Additionally, social medicine became of great importance at the time. The focus of social medicine is to modify lifestyle and to prevent chronic diseases, which is through behavioral change. The public health began to focus on long-term factors that encompassed heart disease, food, and diet. What the author covers is a really good concept that I might use in my introduction, which was that diet is the major cause of the rise of coronary heart disease in the Western world. Because my topic's about nutrition and it's talking about how diet's the main concern, so it's pretty relevant to my topic. As the author describes health and disease, the author explains that the expressions of social and economic inequality is correlated to health and disease. And lastly, the author explains how evidence-based medicine was another component of social medicine, which caused research and evidence to become the most common method to draw conclusions on for advocates and for the government. So basically, public health is based on research and evidence to prove points. That was what the chapter was about. Okay.